Hi, my name is Katie Kjartanson, and I'm here representing Acteon North America. The product that I'm going to talk to you about today is your Sopro Life camera. Life stands for Light-Induced Fluorescent Evaluator. This is an intraoral camera and also a caries detector, so it's 2-in-1. Whenever you're using this camera and you're putting it in a patient's mouth, you always want to make sure you use the sheath. Hold the piece of plastic in between your fingers, lens side down, and pull. This camera is operated by our Sopro touch sensor right here. This sensor is very, very sensitive. It can be used with the sheath and a gloved fingertip. Basically, in order to capture an image, you just run your finger along the sensor and your image has been captured. The image will go to a frozen screen. To make the screen live again, run your finger along the touch, and you have a live image once again until you've selected the touch sensor. Within the camera, you have 4 modes. Your extraoral mode, which is the smallest dot furthest to your left. This mode will take portraits and profiles. It's a 30mm focal range or more. Then you have an intraoral mode. The intraoral mode is great for taking images of smiles, quadrants, an arch form, or even one tooth. The focal range for your intraoral mode is 5 to 20 millimeters. So here's a smile. The next mode is this blue line, which is our caries detection mode. We're going to skip over that for just a minute. And then you've got macro mode. Macro mode is going to magnify your image 115 times. It's important that you remember when you're using macro mode, the focal range is 0 millimeters, meaning the lens of the camera needs to be right up against the tooth surface. Then we are going to go back to the caries detection mode, which is our blue line. Whenever you're in the caries detection mode, you always want to make sure you've got your black cap on. This black cap is autoclavable. Each camera comes with 4 black caps. You'll probably want to have a black cap ready for each patient. Slide it on over the sheath. And basically what this black cap has done is it's blocked out ambient light. It's created a really nice focal range for our camera. And it's a really nice stabilizer, so when you're taking images, you can easily focus and take the correct image. Right now, we're in the caries detection mode, but you notice we still have our white light on. This is called daylight mode. You can use your caries detection in daylight mode just for evaluating the teeth. You want the black cap right against the tooth surface. I'm going to flip the camera over, and we're going to talk about the fluorescent evaluator, or the caries detection. We have 2 buttons, 1 and 2. 1 is going to represent diagnostic mode. 2 is treatment. When I push 1, I've turned on my blue fluorescent light, and 1 should be used for diagnosing decay. Basically what's happening is we have blue fluorescent light emitting from the camera. That blue fluorescent light, when it's shined into a tooth, will penetrate the enamel of the tooth, excite the dentin within the tooth, and what will fluoresce back is the morphology of the tooth. Basically what you're going to see is green, which is good, healthy dentin. Anything that's red is going to represent collagen breakdown or decay. So we see green and a little bit of red. When I push 2, I'm still in the blue fluorescent caries detector mode, but this is for treatment. You want to use this mode when you're in open prep, actually excavating areas of decay. It's a great mode because you're just going to keep removing the areas of red until all of the red is gone. And you're removing only the red, which is only the decayed tissue or the decayed area of the tooth. That falls really well in line with minimally invasive dentistry. We also recommend that once you've removed all of the decay and all of the red is gone, that you document it with taking an image. That way you can always look back and know you've done exactly what you were supposed to do in that tooth. When you're in the blue fluorescent light and you want to go from blue fluorescent back to daylight mode, you just select 1 if you're in 1, and it will go back to daylight. If you're in 2, it's blue now. I'm going to select 2 again. It's going to go back. As far as the care of the camera, when you're done with your patient, remove the black cap. Again, it is autoclavable. Remove your sheath. Take a cavi wipe. You want to make sure it's not sopping wet, just sort of damp, and run the cavi wipe along kind of the base of the camera. Make sure you're not getting the lens wet. This whole portion has been protected with the sheath, so it's not necessary for us to wipe it down with the cavi wipe. To disconnect the camera, you want to hold the base of the docking station and the base of the camera and pull. To connect it back, find the little rectangle on the docking station and the little rectangle on the base of the camera and connect it in with a little snap. Do not pull from here or from here. You want to pull from here and gently disconnect. And that is the Sopro Life camera.